The word cure is often used, but very little accomplished. So one learns one has a chronic autoimmune disease, that there's no cure here, but what there is the ability to manage the disease and to allow the person to live a quality of life that's better than they're living with the disease in its full form. That's all patients really are looking for, is alleviation of symptoms and alleviation of some of the things that make it difficult to exist.
My mother had really bad rheumatoid arthritis, and so I kind of had to watch her go through treatments before the 21st century when things weren't all that good, and kind of watched how that disease progressed. I had to decide that I'm not doing this just for the science, I'm doing it for people with autoimmune disease. And Paul sent me an email and says, do you want an opportunity to bring some truly transformational change to patients, or do you want to just do a safe Me Too drug? And I said, that's all I needed to hear. I said, I've got to go to Nkarta.
We are a patient-focused company. Our CEO, Paul Hastings, is a patient himself. We have many stories internally in our company with people themselves or a loved one or a close friend who've been diagnosed with devastating autoimmune disorders. The fact that we all have the opportunity to work on a potentially transformational therapy for patients with autoimmune disease is near and dear to our heart, and we take that very seriously.
What we've seen is probably the most transformational shift in thinking about treatment for autoimmune disease, maybe ever.
In biotechnology, we follow the science. And the science was pointing us to autoimmune disease when an investigator in Germany treated a group of young women newly diagnosed with lupus and realized that patients with this form of lupus, 100% of them responded to therapy at a very early age and were prevented from going on to full-blown lupus symptoms. And when people saw that you could actually have an impact with these cellular therapies in a disease area of high unmet medical need, where very few drugs were ever really developed that work for these patients, one could see an amazing place to follow the science to use their cells, and that's why we went into autoimmune disease.
Nkarta is looking at a number of these rare diseases with true unmet need in autoimmunity, including inflammatory myositis, ANCA-associated vasculitis, a specific kind of vasculitis, lupus nephritis, which is where lupus affects primarily the kidneys and you can get kidney failure, and another one, scleroderma or systemic sclerosis. Most people know that as you get hardening of the skin, but that too can also very significantly affect your lungs and your heart and your kidneys as well.
My diagnosis of Crohn's occurred when I was 13 years old. The typical life of a patient with autoimmune disease is 24 hours of exhaustion, whether they're awake or sleeping. So autoimmune disease tends to wear on patients, and the symptoms that they get are often primary symptoms, the result of their disease, but there are other symptoms that occur in these patients that are secondary to their primary disease. Depression from being in pain in a nonstop way. Other autoimmune diseases that pop up on top of the autoimmune disease that they have. So these patients are walking around with symptoms all day long.
These are diseases that have been managed by literally just trying to suppress symptoms, right? Steroids, immunosuppressants, just keep the inflammation down so people can just try and live as close to a normal life as possible.
Steroids, I tell people, they are the best drugs that have ever been discovered for inflammation, and they're probably also the worst drugs that we have for inflammation. Acutely, we use them when patients come in with real bad active acute disease. Unfortunately, most of our diseases, we end up using them chronically, and there's a lot of side effects of chronic steroid use. Hypertension, diabetes, osteoporosis, infections, a lot of things that make you think that sometimes the treatment's worse than the disease.
Just to get personal with this, I've seen this with my mother. She was on chronic steroids from an autoimmune condition for a long time. She has severe osteoporosis because of that, and actually has 2 fractures in her back as a result of chronic steroid use. These are the types of things that we deal with, and there are many other side effects. They are not the answer for our conditions that we see in the clinic.
The promise of cell therapy, I think, is one that rheumatologists have been looking for forever.
Being able to develop new therapies like Nkarta's NK cell platform to eliminate the need potentially for steroids would be a major breakthrough and step forward. There are a number of conditions that are steroid dependent that we really don't have treatments in our armamentarium right now to be able to prevent the chronic use of steroids.
Cell therapy is a new way of treating disease by using actual living cells as the drug, as the medicine. So typically you might take a pill or you have an injection that is the actual medicine. Those are different types of molecules that have probably been made in a lab, and then they're stored and you get them at the pharmacy and you take your pill or you take your injection. Cell therapy is a living drug. We are taking cells, so things that are in your body that have a specific function. In this case, these are immune cells. They're there to help fight infections, to try and patrol the body to detect cells that might be behaving badly. Cell therapy basically takes those immune cells whose natural role it is to go and manage these types of abnormal behaviors in your body, and we actually take those cells and we engineer them in a lab to make them more potent, more specific, and really into more of a drug. So in the context of autoimmune disease, you have these pathogenic B cells that are making the autoantibodies that drive disease. An NK cell, a natural killer cell, is a white blood cell made in the body whose natural purpose is to patrol and survey your body for abnormally behaving cells. So that's why your body evolved to have natural killer cells in the first place. They recognize cells that are not behaving normally, and their job is to go attack and kill those cells before they get out of control. So what we do at Nkarta is we take that natural ability of an NK cell and we supercharge it through our engineering. So we genetically modify the NK cells in our research labs, in our manufacturing facility, to make them more active, more potent, last longer, and more targeted for the specific types of bad cells that we want to eliminate. In autoimmune disease, what we find is there's predominantly 3 different markers of bad behaving B cells, but the one that is expressed the most from the earliest B cell to the more mature B cells is CD19. So if you're gonna go in and really say, I'm gonna focus and target one particular marker to eliminate as many of the bad behaving B cells as we can, CD19 is that target. There's a number of different companies that are doing this. Right now, we have a fair number of data points from clinical trials studying CD19 targeted cell therapy in autoimmune disease. And originally it was thought that maybe it would work, but now we have actual data from multiple clinical trials and dozens of patients showing that, yes, not only does it work, but it works really, really well.
That's when you really hit a home run, when you can have an impact on the patient's ability to actually maintain the activities of daily living in a way that's not painful, that's not exhausting, that's not a burden to them. That's really what we're out to treat with therapies for autoimmune diseases. Patient advocacy is important to me because to get to the core of patient advocacy, you have to go well beyond something you can learn in a book. You either live it or you have a family member that's lived it. And by having that connection to a patient makes you that much more effective as an executive, as a pharmaceutical drug developer, as a pharmaceutical discoverer of therapies than it would be had you not had that experience or not experienced that with your child or your parent or your cousin or your uncle. Patients are often experts in their disease and are often stoic about it because if they open their mouth and say something about it, they get judged. And so to live in an environment where you're actually not judged but respected for having gone through that experience is very, very empowering for a patient.
You have to hear the patient stories. You have to understand what their day-to-day is like, what their clinical visits are like, what is easy, what is difficult, where do they see the biggest need for them and the potential of these drugs to impact their lives. I think you have to understand that because that's then going to help you focus on not just the mission, but more specifically, what are the problems that we are trying to solve?
My mom and my husband live with autoimmune disease, and I saw the challenges they faced to be diagnosed, the obstacles they still continue to face to be treated, and often having to look for new treatments as symptoms progress.
For me, I've got ankylosing spondylitis, which is another autoimmune disease that primarily affects your spine, but also your large joints. Something that's challenging for me with that is there's some effective drugs out there, but trying to work through the system to be able to get those drugs is really, really challenging. One of the things that I can really align with other patients and people with these diseases, how long they have to wait to get a diagnosis, and then when they get a diagnosis, get a drug that works. Go to the end of the line, and then as you show that you work, then you can start to be used frontline. And it's a shame because a lot of the treatments and therapies that we're studying now really should be considered frontline.
My mother has 2 autoimmune disorders. Importantly, a lot of these conditions in isolation are quite rare, but when you put them all together in autoimmune disease, it's actually quite common in our society and has a major impact on health. From my personal journey and that with my mother, it's very similar to what a lot of other patients experience and go through.
We try to go out in the community, meet the people who are actually going through these horrible conditions, and see what their quality of life is, what have they tried, how willing they would be, or how much information they would like on our therapy, and whether they think that it would actually change their life. Giving as much information about our company and what we do and what it could potentially do for their life is the approach that we take.
We're here to service and support the patients. So whether it has to do with pricing or developing drugs or researching drugs, we always think of the patient, and we always ask the patient for their input. We don't ask the patients to fight for us on the Hill, to fight for us with Congress, to do our bidding for us. We exist for patients, not the other way around.
A lot of what we do revolves around patients, making sure they're well taken care of, making sure that the burden on the clinical trials are minimized. That could include getting the transportation arranged, allowing for compensation for the patient as well as their caregivers. And many patients also have jobs and children, and so we make sure that those aspects are taken care of as well.
In clinical trials, it's always about safety first. So especially in phase 1, where we are evaluating our drug in a new disease state. So safety is the number one thing.
We have an immense responsibility to take care of our patients that come into our clinical trials. We recognize without their support and their help, we wouldn't be able to advance our treatments. And so we do everything we can to accommodate for them.
Informed consent means that the patient understands in very simple, concrete terms, what does it mean to participate in a trial? What does it mean to receive, in this case, an experimental therapy that has not yet been proven to have clinical efficacy and to be out there for routine use? And of course, the safety component of any trial.
I think the informed consent process is about respect, and it's about giving the patient all the information available, allowing them to see the potential positives, also the potential risks, giving them an opportunity to ask questions, answering their questions, and ensuring that they're heard.
We choose to be here. We're intentional about why we're here every day to do the work we're doing, because again, the end goal here is to help patients and be transformative. This could really change people's lives.
We all celebrate our victories together, and we also go through our struggles together. So I feel like it's a pretty tight-knit community. So that's one thing that definitely stands out in Carta.
There's something powerful about having everyone going in the right direction, working together, and how do we all put our strengths together to move mountains.
When I think about what we're doing and those crazy long days and nights of trying to figure something out or push something through, I can see a face at the end of that. I feel like if we can get this to work, this person I know, I care about, can hopefully live a better life.
Every day, we accomplish the mission. Every day, someone chooses to come to work here. Every day, someone chooses to stay here, despite the risks and rewards of being in a biotech company. By the way, biotech companies are not for the weak at heart. Ultimately, The mission is to take all the good work of those people and to create a therapy that gets approved and that helps patients live a better quality of life. And so if it does work, eureka.